While we've made some tremendous strides in the past year in the treatment of melanoma, a lot of work still needs to be done. Some of these treatments may be curative, but they are curative only in a small percentage of patients, and that stresses the importance of clinical trials. At Roswell Park, we have several clinical trials that are aiming to further this field, that are aiming to improve the care that we can provide for our patients with melanoma. We currently have a clinical trial for a drug called axitinib. This is a trial for patients who have advanced melanoma who may have received up to one prior line of therapy. Axitinib targets a receptor called the vascular endothelial growth factor receptor, which may be overexpressed in a percentage of melanoma patients. We are aiming to determine whether this drug is efficacious in melanoma, and also looking at a special type of PET scan to see if it can predict for a response in melanoma. In addition to this clinical trial, we have another clinical trial which is called the high-dose interleukin-2 SELECT study that is aiming to identify which patients may benefit from high-dose IL-2 therapy. We are part of a national consortium called the Cytokine Working Group, which is doing this on a national basis at multiple other centers around the country. A third clinical trial recently opened for a very specific subset of patients that harbor an abnormality in an oncogene or a cancer-producing gene called c-KIT. We also have surgical trials that are available looking specifically for lymph node dissection in patients to understand that which patients require or don't require a lymph node dissection in the treatment of their melanoma. We are collaborating with our partners in pathology as well as partners in immunology to understand this disease better, and hopefully that will lead us down the pathway of more discoveries. Patients who would like to look at treatment opportunities should look at our website, www.roswellpark.org. There's a lot of information there. They can also call the Ask RPCI helpline. And if they need to touch base with us directly, they can call my office at 845-3099, area code 716, or call the Melanoma Soft Tissue and Melanoma Clinic at area code 716-845-3180, and we will be happy to assist you in answering any queries.